Okay, what's one way?
What's one way?
What is one way?
What's one way we can rebuild trust in public health?
The first thought that comes to mind is to allow oneself to be vulnerable and trust that people have the best intentions.
Seeing the human behind people's responses.
Having more radical empathy for each other.
Think about that shared goal that we all want to be healthy.
Leading with humility. Validate first, facts second.
One word, it's called listen.
Listening.
Listening.
Listening more.
To all different types of opinions, even those who disagree with you. Even when it makes us uncomfortable.
Relationship building.
Relationship building.
Community engagement.
Connect with our community.
Start with one person at a time, and from there we can make little gains that will grow the kind of benefits we need to protect the health of populations.
An N of 1 can be just as powerful, or in some cases more powerful, than an N of 100 or 100,000.
Instead of shaming and blaming people, we need to understand that resistance to any kind of change comes from historical and generational trauma. If we don't address our history, we will be doomed to repeat it.
Own up to mistakes. Be honest about where we don't know things.
Not just telling communities what they need to be doing, but giving them the information to make informed decisions.
Meeting people where they are.
Meet people where they are.
Meet people where they're at.
More public health content on social media.
And public health memes.